Parkes-Weber syndrome. Parkes-Weber syndrome, PWS, is a very rare disorder, present at birth, that causes arteriovenous malformations with abnormal connections fistulas between veins and arteries. What is Parkes-Weber syndrome? Parkes-Weber syndrome is a very rare condition characterized by malformed blood vessels. The vascular malformations occur before birth as the baby is developing in the uterus. The condition affects one arm or leg. Legs are more commonly affected, which can grow larger than the other. The affected blood vessels may include veins, which carry oxygen-emptied blood toward the heart, and arteries, which carry oxygen-rich blood away from the heart. Normally, veins and arteries meet in small vessels called capillaries. In the capillaries, arteries deliver oxygen to nourished tissues, and veins collect carbon dioxide and take it away. In Parkes-Weber syndrome, the veins and arteries can connect abnormally, bypassing the capillaries. The condition has similarities to Klippel-Trenaunay syndrome, another genetic disorder that causes blood vessel malformations that are present at birth. Diagnosis and treatment may be similar for both. What causes that cause a Parkes-Weber syndrome is not conclusively known, but many patients with the symptoms of PWS have a change mutation in a particular gene that may be identified with a genetic blood test. Parkes-Weber syndrome symptoms. The signs and symptoms of Parkes-Weber syndrome are related to malformed blood vessels. A child or adult with Parkes-Weber syndrome may have multiple small abnormal openings fistulas between veins and arteries that affect blood flow. A port wine stain birthmark. These are flat, pink, red, or purple areas on the skin that vary in size. They are caused by enlarged or malformed capillaries, small blood vessels close to the skin. Skin breakdown and ulcers that can lead to infection. Gradual enlargement and deformity of a limb, most often a leg, including its soft tissues and bones. Pain in the affected leg. Heart failure from vascular malformations that affect the speed of blood flow and make the heart work harder over time. Parkes-Weber syndrome diagnosis. In some cases, a doctor can see signs of PWS on an ultrasound of a developing fetus. However, most people with PWS are diagnosed as babies or children. A doctor may diagnose Parkes-Weber syndrome by examining the child, asking parents about the child's growth and development, and prescribing certain tests. Klippel-Trenaunay syndrome versus Parkes-Weber syndrome. PWS has some similarities to Klippel-Trenaunay syndrome (KTS). There are some differences between them, however. Tests for Parkes-Weber syndrome. Radiology tests can help doctors diagnose PWS, distinguish it from KTS, and help with treatment planning. Imaging tests may include ultrasound vascular studies, MRI, magnetic resonance angiography (MRA), CT. Genetic tests.